My name is Rita Omene, Communication 101. I will be talking on the topic. I will be educating the public on the concepts of healthcare inequality and the reason why it should be observed in ensuring that equal opportunity are given to all when it comes to accessing medical services. Choosing between two ways of information sharing. I will be providing a definition of the term healthcare equality as well as discussing the implications of the concept. Therefore, by employing the informative style of writing, I will also be explaining the important issue in details and with some clarity. Healthcare equity means that all people should receive adequate and quality healthcare services irrespective of their financial situation, the color of their skin, their geographical location, their geographical location. Solving this problem is important in order to encourage the development of healthcare society and decreasing avoided mobility. I will use a topical categorical method of organization. This approach enable me to define the healthcare equity, discuss the root causes of disparity, and discuss how the problem can be solved. In this manner, I can arrange my ideas and information in a way that will be easy to understood by the audience. I would like to address anyone interested in public health, community activity, and policy making makers. This cover the students and working professions who want to combat health inequality. Consider a woman carrying her sick child into the emergency room and being turned away because because she has no insurance. This is an imaginary story such things occur every day. Healthcare inequality is a phenomenon which affects millions of people and causes unnecessary pain and even death. As a nurse, the inequality are evidence in our everyday practice. In this post, I will explain why healthcare inequality is why inequality persists. Inequality persists and how change may be implemented to improve the lives of millions of people. Let us discuss why healthcare inequality is not a matter of policy but a matter of conscience. Healthcare equity means that every person should be able to get a healthcare they require, irrespective of their income level, race, or geographical location. Who define health equity would define health equity as avoidance of unnecessary and unfair inequality in the health differences. Population growth and in accessing to healthcare services. The concept is based on the fact that healthcare health is the fundamental human right. However, it is not a case of system inequality make it difficult for the vulnerable groups. Knowing the meaning of healthcare equality now allow the discussion of how the idea is hampered by our societal injustice. Factors that hindered the achievement of healthcare inequality include high cost, high cost, lack of insurance, and variation in access to facilities. For example, the urban hospital are always congested, while the rural regions have severe shortage of health facilities and personnel. And the minorities experience systemic prejudice in the healthcare system, which result in an adverse outcome. A cross-section, a cross-sectional study conducted in 2023 revealed the people in low-income households are 2 to 3 times more likely to suffer the unattended chronic disease due to poverty and the structural factors. Although this barrier may at times appear very difficult to overcome, this paper has explored some creative and collaborative ways of managing them. Healthcare equity cannot be attained without com- uh, combinations of policy changing, community health interventions, and education. Countries with uneven healthcare system like Canada and UK can use as model for tackling uneven access. Investment is in underserved area can also help. Investment in underserved area can also help to fill the gap in the healthcare system. For instance, the Affordable Care Act in United States has increased the coverage to millions of people, but there is still a lot to be done. Last but not the least, community health intervention and awareness enhance the capacity of individuals to demand for their right and freely access services. By identifying this system barrier and offering specific measures for this elimination, it will be possible to design a health care system that function equally well for every citizen. Healthcare healthcare equity is not just a agenda for a provision of healthcare services. It is also a question of justice and human right. With the definition of healthcare equity in mind, knowing the barriers that exist as well as the possible measures that can be taken to eliminate them, it is possible to work towards a future in which no one is excluded from receiving the necessary medical care. So, as you work away from this moment, I will encourage you to ask yourself how you can support this important mission. Together, Together, we can work towards making healthcare a right for everyone in the world and not just a privilege. Thank you. In order to assist my speech, I will incorporate the PowerPoint presentation, some of the items that I will use in my slide are satisfactory graphics on healthcare inequality and image that create a sense of compassion. This will help in making the audience more engaged and ensure that they are well informed as certain issue as a certain inform on certain issue. For instance, I will provide a graphic showing the result of healthcare inequality an equitable system. This aid will help to make the inattendenced message clear and also easy to remember. Thanks.